Bring them onto the program right now from San Juan Regional Medical Center. Dr. Bob Underwood, good morning, and good to have you on the program.
Good morning, Scott. Good to be here. Thanks.
You bet. Thank you. And Dr. Brett Greenberg is back with us, who it's always a pleasure to have on the program as well. Dr. Greenberg, good morning to you.
Good morning, Scott. Thanks so much for having us.
You bet. Thank you both for your time. I know it's a busy time for everyone at the hospital, it seems. And so, Dr. Underwood, can we start with you about the current conditions at the hospital today? How are things looking?
Sure. And again, good morning. We're still very busy, of course, at the hospital. We are still in, as a lot of people already know, in what we call crisis standards of care, where the number of patients that we have exceed our licensed capacity and even our contingency capacity in a lot of ways. And so currently, including our rehab facility, we have 177 patients in-house. 58 of those patients are COVID positive. Our intensive care unit is completely full. Our step-down unit, which we've converted into an intensive care unit, is also completely full. And we have 8 patients that are intensive care level, but they are on a regular floor right now in beds that we've modified to be intensive care. So we are still at 126% of our contingency ICU capacity. So we're above where we ought to be. However, I want to say that these numbers have been trending in the right direction for the last week or more. And so we hope and we're confident that we are starting to see a downslide in the number of COVID patients and the criticality of some of those COVID patients in our facility.
Well, that sounds encouraging, and thank you for sharing that. Dr. Greenberg, again, you are on really literally the front lines at the hospital, and so as Dr. Underwood is saying, do you see any less of a demand on your time or your colleagues in the ICU and other places?
Well, Scott, I think that I'd like to echo what Dr. Underwood said, is that we are seeing some softening of our COVID volumes. That being said, we had a lot of COVID patients in the hospital, and there are lots of folks, many different professional disciplines, working so hard to take care of our community. And so even though we've had some softening in those numbers, the numbers are still very high. And so I think that we continue to work very hard, especially as we approach, the holiday and New Year. And I think that we continue to enjoy the support, ongoing support of the folks that are deployed from the United States Navy. And really this external support is helping us meet the demands of the peak that we hope is behind us and the ongoing challenges. So I think it really is right now, this is a question of endurance, discipline, and I feel very fortunate to work with such a wonderful group of professionals with such fortitude.
Indeed, thank you. And we know that the hospital is getting a lot of other support from outside because of staffing issues and just because of the patient numbers and just the volume of folks who are showing up at the hospital suffering from the effects of COVID-19. Dr. Greenberg, can you talk to me a little bit about some of the other, I know some of the treatment options, the monoclonal antibody treatment option has been now expanded to 7 days a week. Can we talk about that for a bit?
Absolutely. We do our best to make sure that we continue to provide all of the treatment options that may be available and that science has borne out really do represent an improvement in what happens for patients. Monoclonal antibody infusion therapy absolutely is one of those options that's been shown to reduce hospitalizations by up to about 70%. So we now have upwards of about 140 slots per week that are available. And so if folks are indeed diagnosed with COVID-19, and there's plenty of COVID in our community still, then I absolutely recommend consulting with their primary care physicians to see whether or not monoclonal antibody infusion therapy would be right for them. And then the likely we would likely be able to find a slot for these folks, and hopefully they would be able to stay out of the hospital. So we have not yet begun to, there are a couple of different oral antiviral medications that are just on the horizon. Merck and Pfizer both have products. And so we are looking forward to when they are released after their review by the FDA. And hopefully those also will reduce the likelihood of hospitalization. So those are on the horizon, but not yet with us.
Understood, and thank you. But that monoclonal antibody treatment certainly has had a lot of data now behind it and proven to be pretty effective at the early onset of COVID-19. I guess that's the key, right? That you have to start that treatment fairly early on in the infection for it to be effective and keep folks out of the hospital.
Absolutely. I think that we all believe that the sooner the better, but it absolutely must be done within 10 days of diagnosis.
Thank you. Very good. Dr. Underwood, I want to come back to you and ask you a bit about those folks who are at San Juan Regional Medical Center who have needed to be hospitalized because of their COVID-19 infections. And I think we've said before that the vast majority of these folks are unvaccinated individuals. Is that still the case at the hospital these days?
Absolutely, that is correct. Even to date, the most effective way to avoid requiring hospitalization or becoming ill is the vaccination, one of the three that are currently available within the United States. So that has been, since the vaccination has become available, which is almost a year now, that has been one of our strongest recommendations is if you're eligible, become vaccinated. If you're eligible for the booster, get the booster vaccination as well, because it is clearly shown to be significantly protective from getting the disease, becoming symptomatic, being hospitalized, and death. It is the best option out there to avoid all of those things.
Got it. Thank you very much. And Dr. Greenberg, I want to ask you about these patients that are hospitalized, and we see stories even in the national press about that these folks who are very, very sick, and all of a sudden they, I guess, literally see the light and decide that maybe they need to get the vaccine, but at some point it's too late. Is that something that you've had to have a conversation about at San Juan Regional with any of your patients?
Well, Scott, this is actually a very common conversation among the unvaccinated who end up hospitalized. I think most of them who are hospitalized, and the ones that I've seen personally do indeed ask, can I get the vaccine now? And you're correct, it's too late at that time. Vaccines require time to both stimulate and then to really build an immune response that has to be there when the virus then poses a challenge to that immune system later. So you can't have the infection and get the vaccine. You need the vaccine first to protect yourself from the infection. So I think that those folks that have indeed recovered from COVID-19, those folks still need to get the vaccine. There's been some great studies that have shown that the immunity conferred by being sick with the illness is not the same. It's not as long-standing or as broad as the immunity conferred by vaccination. So yes, we do indeed see that. It's very sad and sometimes tragic that folks have a change of heart when it's too late. But for those folks that have had COVID and have also recovered, get the vaccine now. And if you've had the vaccine, go ahead and get boosted.
Great point, because I think we see that a lot. And I want to ask you too, Dr. Greenberg, about these variants that we're hearing about. Of course, we know Delta is surging in our state. That's really what most of the cases are these days, it's my understanding. But we now have had a case of the Omicron variant in New Mexico. I don't know if we've seen it yet here locally. Maybe you folks can tell me if that's the case or not. But that's a concern as well. And is it possible that if someone had maybe the original COVID and then they become infected with a variant, that again their immunity is not really going to offer much protection, if any, from these as this virus mutates and changes over time? Dr. Greenberg?
Well, variants are definitely right now, especially Omicron, are at the front of everyone's mind. But that point, Scott, is exactly right. It looks like the studies show that previous infection with other variants of COVID-19 are not protective against Omicron. They're not protective against the infection and perhaps the transmission of the virus. Now, it is still unclear what the relationship between previous infection and severe COVID is, like hospitalization or death. But the news right now is full of information about Omicron, and we continue to learn the science behind it day by day, really hour by hour. But the cases for Omicron right now are just skyrocketing. They have the case records in Europe are highest than they've ever been in the UK, France, and Denmark. We're starting to see increases within the United States with 13 to 14% of the cases in New York and New Jersey being Omicron. And really, it looks like within the United States, we are expecting really rapidly increasing growth in Omicron, with those likely to peak sometime in January, maybe the first half of January. So there's still some science that's evolving right now about why this infection is so apparently more transmissible than previous versions, previous variants of COVID-19, even Delta, which we thought was more transmissible than the previous one. So we're very much hoping that vaccination, as well as cellular immunity or T-cell immunity, helps keep folks out of the hospital. And that is a really important piece. I think that two subpopulations that do look like they should absolutely consider doing something at this point, really those that are the older adults that have perhaps received two vaccines, say two Moderna or two Pfizer vaccines. At this point, given the projections with what's happening with Omicron, we really would like to encourage those folks to go get boosted. It is absolutely important for those folks with the waning immunity conferred by those two vaccines to go get another vaccine to improve their immunity. The other subpopulation that really looks like folks in the experience in South Africa is somewhat concerning, has been those that are 0 to 4. And so it's not entirely clear, and the science still continues to evolve with Omicron as it relates to why there are more hospitalizations in that subgroup than previous variants of COVID-19. But I think really COVID-safe practices need to carry the day for that subgroup. Families need to really exercise good judgment and make very good decisions about social distancing, hand hygiene, masking, and making good decisions as we're approaching the holiday season. So I think that we are looking at a time where case counts are likely to get very high. And we're all hoping very much that all of the work that we've done so far can help preserve and minimize the impact to the healthcare infrastructure, so hospitals won't be flooded by these folks. So now's the time to get vaccinated. If you've been vaccinated, get boosted. And now's the time, even as we're approaching the holiday season, to try to make the best decisions about how COVID-safe practices can ensure that not only will you stay safe for the holidays, but the holidays can be joyous for your friends and family.
A great message, Dr. Greenberg. Thank you very much. Dr. Underwood, I wanted to ask you a bit about the situation statewide. You mentioned, of course, San Juan Regional is still under the crisis standards of care here. How is the situation at other hospitals? Is that eased up at all? Are you able to transfer out any patients when things do get pretty crowded there? Or what are you dealing with each day?
So transfers are still difficult, but are lightening up the capability of being able to transfer somewhat. Mm-hmm. I would say that the trend that we're seeing in a positive direction is not completely reflected across the rest of the state right now. So we have noticed regionality of these things in the past, that what's happening in one part of the state may not be what's happening throughout the state. In fact, we're seeing across the Navajo Nation, extending westward into Arizona, that there is an increase across that portion of the Navajo Nation. And so what impact, again, that's going to have on our healthcare facility? Of course, we're part of that referral pattern even out of Arizona. What impact that's going to have on us and the availability of clinical assets is still kind of a question, but we're paying very close attention to what those trends are looking like. So again, what we're seeing is a little bit more favorable than what the rest of the state is seeing in terms of that lightening.
Good to hear. Well, and maybe give you folks a little bit of breathing room as things move forward here. And thank you, Dr. Greenberg. I think maybe my final question this morning. I know you both are limited time with us today, but I wanted to ask you, and I didn't catch. Have we seen an Omicron variant case here in San Juan County yet, to your knowledge? And then I guess the second question is about the flu season. How is that looking these days? And are we seeing some flu cases at the hospital these days?
Great question, Scott. So the first answer so far is not that we're aware of. So
no Omicron.
The single case, the single case of Omicron was in Bernalillo County, and we continue to get positive COVID-19 specimens sent to the state laboratory division for genomic analysis, and we have yet to receive any notification that we have had any positive cases of Omicron. We still have, we're Delta, Delta top to bottom. Now, as far as influenza, we are absolutely seeing both influenza and respiratory syncytial virus, or RSV, at the hospital. We have folks that are testing positive, and we've had, I think, a single hospital admission for influenza A and a steady, but I would say a modest stream of RSV admissions. Now, we do expect those things for this time of year. So I think that last year was somewhat of an aberrancy in that we didn't see those kinds of viruses circulating in the community. So it does represent a sort of simultaneous challenge to the hospital to cope with these other folks. And the message, I think, really super important, it is not too late to get your flu vaccine. And I know that there's some press out there about, does the flu vaccine that was released this year match up with the circulating strain? And, there's always a certain degree of, if you get these flu vaccines, you will get protected. And the key is really it's not that you won't perhaps get the infection, but you'll stay out of the hospital. Like we need folks to build this immunity. So get your flu shot, stay healthy, and do those COVID safe practices, which will also keep you safe from things like RSV and influenza.
Very good. Good advice from both of you this morning, gentlemen. I always appreciate your time. Thank you for sharing some of it with our listeners and viewers this morning. And I hope you both have a very safe and happy holiday with your families coming.